Tell me a little bit about the team efforts and the expertise.
When I was there, we had a very substantial amount of African American leaders in executive positions, which was very good because it reflected the population that we served.
And you actually solved the issues for all children. As a result, that Black children and families have been overrepresented in the child welfare system. When you begin to look at other strategic partnerships, how are you guys approaching that?
You know, we needed to bring in the fold those particular people, those police officers, people in the Board of Education, and they were there.
You shared about the Healing Illinois. Is that a replicated program? And those action teams, which sounds so imperative to change and growth, because it sounds like they are more of the laity of the community.
We really wanted to start B.A.C.W chapter here in Illinois. We felt the timing was right. The government system in child welfare was really in a disarray, and there was a desperate need for training and developing new African American leaders. So in 2014, we chartered the Illinois chapter of Black administrators in child welfare. So that's pretty much where I am. I've been very active with BACW for the past 10 years, enjoying all of it because I have a great team. The chapter is so supportive and they're so talented and experienced in the field of child welfare.
So much, Jack. Wow, what a lengthy history, and you talked about your sojourn in this effort and where it started from, and we BACW are just so excited about you taking the initiative and your team taking the initiative to create and establish a BACW chapter there in Illinois, because as I said earlier, I mean, across this country we are seeing and continue to see the traumatic outcomes of African American children and families in the child welfare system, and asking and pleading for change and transformation to take place. But as we all know, change has to happen at the grassroots level. Change has to happen with each and every one of us, and we are our own rescuers. And so if not us, who else? Mm-hmm. And so we're excited about the effort that you're taking on there in Illinois. So Jacqueline, tell me a little bit about what you see as the state of affairs for child welfare there in Illinois, and also, has it changed any since your starting period with the system?
Oh, that's such a loaded question, Keith, but you know what? I'm going to dive into it.
All right.
Because I've had so much experience here in Illinois in the child welfare system, it's, I'm going to be very candid. It's so disheartening to see how the system is now. When I reflect back on how it was when I was part of the system, and how we had a team of experienced people in leadership in every facet of the system. And as we move forward to now, what I'm seeing is a system pretty much just fragmented. It's almost, I hate to say it's broken, but I can see it being on the verge of getting there if we don't provide them with the supports that they need. To be a little bit more in detail, since I retired 10 years ago, the government system, DCFS, has gone through 3 different directors over a 10-year period. So you can imagine the transition, the transformation, the disruption in leadership that has gone over a decade, and the impact that is having on our community, on our children and families that are part of the system. So, that's what's really happening with the system in Illinois right now. There's a need to transform it. And BACW can play a very vital role in doing that transformation. And we're starting to lay some groundwork now, in doing some various things in Chicago, and not only in Chicago, but statewide. And, we have partnerships that, I will be more than willing to talk to you about later on in this podcast, but we're doing some great things in trying to support not only the public sector, but the private sector in child welfare.
Thank you, Jacqueline. You hit upon a number of different points there in trying to map out the current state of affairs there in Illinois, and you elevated the fact that things have changed. I mean, you talked earlier about teams, and you talked about expertise and leadership. Tell me a little bit about the team efforts and the expertise. Or did you see more individuals who were staying in the practice longer, or they were more willing, more flexible? What are you seeing in individuals who are charged with carrying out services and supports? And then tell us a little bit about, leadership and what you're not seeing.
Okay, the best way to respond to that is to do sort of a comparative analysis on how it was and how it is. I'm going to go back to how it was when I was there. We had an executive team of experienced people with, I would say, an average of 25 years of experience within the system. Okay, and everyone worked up through the ranks, knew how the system operated. We worked as a team. We were knowledgeable. We provided the supports, and the numbers were much lower, in terms of the number of children in care, because we knew what we were doing. We knew how to transition them into permanency. We had a director at the time when I was in administration, and also as associate deputy. We had a director at the time who was African American, who started out as a social worker, Erwin McEwen. Okay. And he was like our team leader. What was so great about Erwin was that he did not do anything without going to his team. It was always a team effort. Whatever charge he was given, he would always go back to his leadership team to see how we can make it happen. So that's how it was back then. And conversely, what happened with all of that was that we were able to move cases into permanency. We had good supportive staff. The retention was great. Now, comparing that to how it is now, like I had mentioned earlier, DCFS has gone through 3 different directors over the past 10 years. And all 3 of those directors did not bring to the table the amount of experience that was needed to run a child welfare agency. So therefore, the leadership was not there. Also, I want to mention to you that when I was there, we had a very substantial amount of African American leaders in executive positions, which was very good because it reflected the population that we served. Okay, we had the majority of the population that we served was African Americans, so we had a majority executive team of African Americans. Now, if you look at it now, you still have those numbers of the majority of children in care are African American or children of color. Okay, but when you look at the executive team, the majority, they're Caucasian. Okay, I would say maybe 85 to 90% of the executive staff now is Caucasian. Okay, so I just wanted to throw that racial inequity piece in as it relates to leadership in Illinois, because it's a significant piece, and it's a piece that BACW Illinois is really looking at.
Thanks, Jackie. I mean, you hit on the point that we can't have this conversation without race. It is very clear. It is very apparent that that shift has occurred. Some might argue that it was happenstance, and I would argue that it's been intentional. We at B.A.C.W. have once again always been unapologetic in our efforts and our comments about that. If you solve the issues for Black children and families and communities, then you actually solve the issues for all children. As a result, that Black children and families have been overrepresented in the child welfare systems, that have been disproportionate in how they impact their lives. And so we too recognize that we have to do everything possible to strengthen and uplift leaders. I mean, you talked earlier about your previous leader, Erwin, and how through his guidance and his vision infused that connection that allowed you all to think broadly, to think empathically for families and to think about meaningful and mattering outcomes. And so we at BACW, and you're very familiar with this, we created the Sankofa Leadership Institute. And the Sankofa Leadership Institute is designed and developed to build, to strengthen, and to enhance and support African American leaders, those at the mid-level, those at the executive levels, to give them that sense of space and that sense of support and partnership that helps them one, become bigger and better leaders, and also to help them support and help them navigate through the daunting challenges that African American leaders face in this child welfare system. And we want to applaud you all in Illinois that you all have kind of replicated some of that to create your leadership institute there in Illinois. And so we believe that it's a combination. It's going to require that leadership that people can see. It's going to require that commitment to be unwavering, and to recognize also that oftentimes in this political environment that we sit, those seats are time limited. I think that might be another change that we've seen over the years. I too, Jackie, have been in this toil for almost 40 some odd years, and that the length of time that leaders have to do the impossible is so extremely short. And so the goal is to help equip them to do the best and the most that they can while they're in those seats. And hopefully then to if they do have to leave those seats, that we replace them with other capable leaders. And so that's been one of the issues, is that systems have said, well, we can't find African American leaders. Well, we're going to help that. We're going to solve that. We're going to provide you with a plethora of African American leaders who are capable in doing and leading this work. And so, Jackie, let me shift just a little bit and ask you about, if you had to identify 2 or 3 practice areas in child welfare that definitely need reform or that needs transformation, what might they be? I know you talked about the great outcomes you all had in permanency, but what do you see or have a pulse on that immediately needs to change, or that needs a constant eye on?
I think about the competencies that workers are trained on and managers are trained on as it relates to decision making. I think that is a really big piece that we really need to hone in on. A lot of times you have people in leadership positions that are not comfortable in making decisions about the lives of children and families that they serve. And there's so many competencies out here that deals with skill building around decision making, which seriously impacts the practice of social work. So I think that's one of the gray areas that we're dealing with, and it impacts how we move permanency. You have supervisors, and I hear this constantly. You have supervisors in positions that don't feel like they have the authority to make that kind of decision to move a child into permanency because of the so many layers that are either above them or that they have to collaborate with in order to make that decision. I'm talking about the court systems. I'm talking about the political environment that they might be in that might impact that particular decision. So if you had competencies where you could bring them into the fold and make them comfortable enough and give them the resources that they need to make those decisions. And that's one of the things that we are targeting in our Leadership Institute. We want to have a takeaway for each one of those cohort members to feel like I can go back. I have this razor curriculum in my head and I can practice it, So I think that's one of the things, and I hope I'm gearing in on your question, Keith. A lot of times I kind of drift, but I hope that answers your question.
Yeah, no, we see throughout the, BACW is a part of Thriving Families for Safer Children. across this country where we're working with different jurisdictions around transforming their systems into hopefully a child well-being network versus child welfare system. And we still oftentimes struggle, or those jurisdictions struggle with getting beyond what I call surveillance versus support. And once again, I'm tying it back to the race. Oftentimes in African American communities, with African American systems, it's about the surveillance versus the support. Many of our children and families are surveilled to these significant risk issues and come to the attention of the child welfare systems, and their policies dictate that certain families get surveillance and other families get support. Oftentimes, African American families are the ones that are surveilled and come to the attention, and our children are removed. And so I think that that's an area that we've heard and that we work with jurisdictions on around working with communities, understanding communities, looking through their practice, looking through policies through race equity lens.
Right. Absolutely.
And so share a little bit about how you all in Illinois have the conversations with systems and institutions about race, and that race matters, and that you can't really have decisions without understanding about the journeys of individuals who you serve.
One of the things that we were fortunate to do is we received some funding to have statewide grants that dealt with racial healing, and we entitled the town hall meetings Healing Illinois town hall meetings, and we were able to go into central Illinois, which according to the data is one of the major areas where there's so much disproportionality, and there's so many issues as it relates to race and children in care, and the decisions that are made around bringing children into care. So we went into central Illinois, and we had 3 separate town hall meetings in 3 separate areas in central Illinois. And the title of it, of the town hall meetings, was Where We've Been, Where We Are Now, and Where We Need to Go, And it was really very impactful. We had a total of over 130 participants ranging. It was a very diverse group in each area, in each location. We had representatives from, of course, from DCFS and from the private sector, a lot of private organizations. We had NAACP there. Mental health was in the room. The police department in the various locations, representatives from the police department was there. And we also had a large group that really partnered with us, and they were the advocacy centers. And the advocacy centers are a product of a major initiative that's been around for about 25 years in Illinois. It was spearheaded from the Department of Children and Family Services, African American Advisory Council. And Michael Burns really spearheaded that whole initiative about 25 years ago. And as a result of that, several advocacy centers were formed throughout Illinois. And they are very active in central Illinois. So they took a part in that town hall meeting to a point where they participated, they had representation. They also supported us in organizing those meetings and getting the people to attend those meetings. So they were under the auspices, like I say, of the Permanency Enhancement Program, which is very strong in central Illinois. So the takeaways from that, it was really great. We were able to strategize. What we wanted to get was more involvement in those communities of people coming into those action teams, those advocacy centers. And that's what we received. The other partner to the advocacy centers were action teams. And those are the teams in those particular locations that actually work in the community, organize, develop events around permanency, address the issues of disproportionality within the system. So we were able to get additional members to join those teams as a result of those town hall meetings. So our mission pretty much was accomplished, and we were very proud. We also had the support of Illinois State University, which was great. Their School of Social Work was there, and we just had a great partnership. So it was wonderful, and we were able to talk about race in a way that we have not been able to do so in Illinois. We had one facilitator who was a clinician who did a great job in breakouts and getting everyone to really talk about race, to really talk about DEI. And we're talking about a room full of Caucasians. In fact, one of the town hall meetings, the majority in attendance they were white, and we were able to get them to really talk about race and DEI. So, we really accomplished a lot out of those town hall meetings. We have a lot more to do, but it was an experience, and we knew where everybody was and where we needed to go.
So that's really powerful, because several jurisdictions, struggle with navigating through those political landmines, and have resulted in or reverted into just saying, hey, it's too hard, it's too tough, can't do it, I'm fearful of losing my job. And so things just stay stagnant and things don't move. And so with BACW, we have been known, stated, and at times accused of pushing it forward, trying to move the needle, sometimes the only one in the room that's having this conversation, or being able to at least elicit or at least try to stimulate the conversation. And that's what we will continue to do. Jacqueline, you talked about partnerships and you talked about the engagement of others. One of the challenges that I think this movement has is oftentimes we're preaching to the choir,
Mm-hmm.
and it's called the choirs are the people who toiled in this work, the workers, and those in the child welfare system, when we really need to be looking at how do we engage others to have a responsibility along with the choir, as I'm calling the choir. An example would be in many of these conversations around transformation, it lacks the school system, school board, where we recognize that almost 70% of all the referrals that come to the child welfare system come through schools.
Mm-hmm.
And if they are not at the table or not being involved in this conversation or this process, how can we ever bring about the change? Many people are unhoused. And so if the housing authority or local HUD is not involved in these conversations, or workforce. And so when you begin to look at other strategic partnerships, how are you guys approaching that? Or are you seeing some of those same individuals standing on the sideline, and it's still just the choir of Illinois?
Mm-hmm. One of the strategy we had behind those town hall meetings was exactly what you're addressing. We needed to bring in the fold those particular people, those police officers, the people in the Board of Education, and they were there. They heard, they participated, and they also signed up to be a part of those action teams. And what the beauty about the action teams is that they are addressing issues as it relates to education, as it relates to criminal justice within those communities. And they have members on their teams that are employees with the Board of Education in the various areas, especially in Central Illinois. They have police officers now on board. So I think we're beginning, we're taking baby steps, but we're beginning to see and get them involved and get them to understand. One of the other things that the action teams, they're really looking at is reporting. Who's reporting and what type of allegations is being reported? Is it geared toward toward African Americans. In other words, is it really abuse or is it neglect? You know, and is neglect an allegation, or is it a situation that Black folks just have to experience based upon their current situation? You know, so the action teams are really, you know, deciphering that. They're looking at the types of reports that are coming into the system, and whether there's a trend. Maybe we're looking at some type of racial oriented type of reporting, you know. So it's a lot of work that we have to do, but I think a lot of work has been done through these action teams, which is, like I say, under the auspices of the Permanency Enhancement Program in Illinois.
Said something just there about, you know, is it just about, you know, whether it's, you know, these allegations, are these germane just to Black folks, or do you have an understanding that, you know, just living Black sometimes come with risk factors,
Mm-hmm.
but they're not they're the risk factors that can be overcome. Children aren't harmed, they aren't hurt, and in many situations are well.
Mm-hmm.
And many people miss the traumatic experience, long-term effect of the removal of a child from a parent and or family and or kin. And so when you look at next steps, so you look at the horizon and how you continue the movement, twofold question. One is, what do you see your next 2 to 3 action steps being? And then the second part of it, how can BACW help you in achieving and accomplishing that?
You know, when I look at where we are here in Illinois with BACW, you know, we're doing the major initiatives that we have right now. One of the major ones is the Leadership Institute. We are in a position here in Illinois where there's no leadership in child welfare in the public sector. You know, not the type of leadership that's needed to move our children out of care. So what we're trying to do is to really, really get these leadership institutes out there and get the graduates of those institutes into leadership positions. And one of the things that we realize that we can't do this alone. You know, it's always, we all know, you know, you have to have some political backing, you know, to get folks to understand that, you know, we have African American leaders out here that can assume these roles. The question is, how can we get them in those positions? You know, and when you deal with governmental agents, you're dealing with a political arena. And so we have to also look at those type of partnerships. We're having conversations. We've had them in the past, and it's our plan as we move forward to increase it. And that's with the legislators, the Illinois Black Caucus. You know, we've had that conversation with them, and we want to continue to have that conversation. We need their support, you know, to sanction the leadership institutes. The other piece that is so important is community, you know, and looking at the whole issue of well-being, you know, as opposed to neglect and abuse. Because if you address the whole issue of well-being and shift it over to well-being instead of just targeting something around abuse and neglect, then that whole abuse and neglect issue will not be as paramount as it is now. Because we all know that if we improve the lives of our children and families, that you won't have an issue of neglect. You won't have an issue of abuse, but you have to improve the well-being of our children and families. So you have to bring in the community to do that. You know, it takes a village. We have to bring in various facets of the community to do that. So BACW we want to be at that table, you know, and it has to be a table statewide in Illinois. And it is a challenge. It is a challenge because of the political arena here in Illinois.
Yes. And once again, like I said, the movement has to continue. And the national office here at BACW, you know, is more than willing to help and to assist and to be a partner in lockstep with you. You know, you talked about community and families. what what are you seeing from families? A desire to be engaged or to be involved? Is it a level of trust that has been lost? I know I say this sometime in these jurisdictions. I said we have I mean, child welfare is a horrible product.
Mm-hmm.
It is a horrible commodity. You know, who to sell. Hi, I'm Keith Bostic, and I'm here from the Department of Children and Families, and I'm here to help you. Well, that's almost an oxymoron because last time that you came to help, you took my child away.
Mm-hmm. Mm-hmm.
And so, how do you shift those narratives around people's belief around the movement and the community's trust in that well can occur?
I think that's where prevention comes in. We have, you're right. The Department of Child Welfare, we're labeled as folks that come into families and take their children away from them, and the children language and care, and they stay in foster care. I think we need to look at the other perspective, and that is prevention, and talk about prevention with families, as opposed to always talking about what's going to happen to your child now that your child's in care. How can we prevent your child from coming into care? What is needed in the community? What supports are needed in the community to prevent your child from coming into care? Or if your child is returned home, one of the other aspects that we're focusing on, I think is so important, is reunification. When children are returned home, we cannot just abandon that family once that child is returned home. That's the most important part of social work, is once the child is returned home, what supports do we need to give that family? And one of the things in Illinois that's much needed is resources. There's so many disparities when it comes to treatment of African American children and families in the community. So that's another piece that, in terms of moving forward with BACW Illinois, that we're going to have to look at. We're going to have to advocate for. We're going to have to create. We're going to have to work with partners in the community, people, organizations such as NAACP, organizations such as even the educators. What resources can we add in these communities to keep these children at home and prevent them from going into care? So prevention to me is a big piece in terms of moving forward.
Yeah, I heard.
I have a question there. I have a
Sure,
question there, Jacqueline. Sorry to interrupt. This was a great flow and lots of information. You shared about the Healing Illinois. Is that a replicated program? And those action teams, which sounds so imperative to change and growth, because it sounds like they are more of the laity of the community, being brought in, not just the leadership, but those that are actually doing the footwork and connecting to the families. And there's a term that Keith typically uses, and help me out, Keith, here, where it's that family or that person in the community that everyone tends to run to. It's that house. It's that one house. It sounds like your action team is doing that. Keith, what's the term you normally use for that? Mr. Someone. Is it Mr. Smith or Mr.
All right. So yeah, I think
Big Mama.
well, yeah, Big Mama needs to be there as well. But it's really about that. I truly believe that we need to stop doing needs assessments, on and with communities, especially our Black communities. I think we need to transform them into gift assessments.
Yes.
Because within every community, within every Black community, there are gifts. And that if we start there with those gifts, then we build around and say, what can we add to strengthen those gifts? What Lisa was sharing is that I always make this reference that in every Black community, there is a Mr. or a Mrs. Smitty. And that, or those people are maybe people like the person who owns the convenience store that's right in the heart of the community. Those people can tell you what the strengths are. They can tell you, they can actually tell you who has better parental skills than others. They see folks coming into the store all the time and how they interact with their children, etc. But it's tapping those individuals who we oftentimes we miss out and that we don't address, who have key information, who could be key partners in this change, because as we know, we need to see Black leaders.
Mhm.
Communities need to see people like them being a part of the change as being part of the change.
Right.
And so the more that we can do to do that, I think will add and lead to prevention. You talked earlier about elevating that. I think that we have to also help those systems that are supposed to serve and support us to understand that some of the practices that are in Black communities and with Black families have always been identified as prevention.
Mm-hmm.
I mean, they may not line up in evidence-based systems that are now being touted as that's where we need to go, but families have always had an ability to keep kids and families safe if we allow them.
Mm-hmm. Mm-hmm. Mm-hmm.
And so, yeah, finding those Mr. and Mrs. Smitties and finding out that whole connection to be a part of that particular process. And so prevention, you said, Jackie, you said support families need, and they need added resources.
Mm-hmm.
And we wholeheartedly agree with that and believe that all those things are possible. It will require quite a lift, but that we have to stay together. And once again, if we don't, nobody else will.
Right.
And so, Jack, I'm gonna give you this final bit of time to just final couple of seconds to just talk about and share with us, just kind of one of your last thoughts that you would like to share with the group about change in Illinois.
Well, I think what really is really on my mind a lot, and not only me as an individual, but as the organization here in Illinois, is how can we make significant changes to not only keep children out of care, but move them faster toward permanency, and how can we get the right leadership in place to make sure that that happens? We have the good thing about Illinois is that our frontline workers, the ones that are in the trenches, they've been there. They've sustained it. They've gone through a lot. They've dealt with all kinds of transitions. But in terms of what BACW is really concerned about here in Illinois is they need the leadership. They need leaders. They need leaders with the right mindset. They need leaders that really know how to deal with the issue of race as it relates to decision making. And it goes beyond just African American leaders. We need to also look at these Caucasian leaders and bring them into the mindset that we need everyone to be in, and that is equity. That is racial equity across the board, racial equity in leadership, equity in terms of how we're supporting our families here in Illinois. So one of the takeaways that I would like to just say before we conclude this podcast is that we in BACW, we really need to work as a team. And when I'm saying team, I don't mean just in Illinois. I mean nationally throughout this country, because what we're talking about today is not just unique to Illinois. We all are dealing with African American families throughout this country that are dealing with the same kind of issues, the same kind of systems that they have to battle with constantly to either keep their children out of care or to do whatever is necessary to bring them home. But the daunting part about this is that we need to make some changes as it relates to the length of stay, with African American children. I look at data, especially the data of our older African American kids that just emancipate from the system, that are not adopted, and one of the things that we're also looking at in Illinois, we're partnering with Dr. Annetta Wilson and the Casey Foundation and looking at training social workers on youth adoption. That's one barrier in terms of why they are languishing in care. So as we move forward, I think we need to look at those dynamics, those variables that I've talked about. But it's a national issue, So that's where we are.
Thank you so much,
Keith,
Jackie.
can I ask this one question again? So is the Healing Illinois, is that a replicable program that's going outside of just Illinois?
Well, right now, no. We received, but I'm not saying it can't be. I
Okay.
think it's a good foundation, and we need to take it outside of Illinois. We
Mhm.
were just able to put it to move forward with it in an expeditious manner because we received the funding from the Department of Human Services here in Illinois under their program, which is entitled Healing Illinois.
Okay.
But what we got out of it, I think we can take it and move it outside of Illinois, and that's through partnerships and that's through BACW,
That's
yeah.
wonderful. Okay, that
Mhm.
answers my question. I do also, before Keith says his last possible question or statement, how can our audience become a part of BACW Illinois, and how can they engage outside of your website, which is full of great information? It's a wonderful website. How can our audience better get in touch with you all or engage with you? And what do you have coming up next?
Well, you said outside the website, but that's our vehicle. And it's a good vehicle because
Yes, it is.
we're beginning to get feedback. In fact, I was really impressed in terms of getting some communication recently. I think it was from Florida, from the
Mhm.
University of Florida. I can't recall. One of the students there is working on her PhD on racial equity
Mhm.
and wanted BACW Illinois. They had looked at our Healing Illinois and they had looked at some other things on our website and wanted to know if we would support that particular piece. So we're beginning to look at what they're doing and making some decisions on how we can support, the racial equity piece that's in the dissertation. So in terms of people that are listening to this podcast, yes, you can be a part of the solution with us, and that's what I call it. Just, how can we resolve some of this? And it takes a village, and the village is beyond Illinois. So the things that we're doing, we're posting it on our website, and we will continue
Yes,
to
you
have,
are.
and we'll continue to have our leadership institutes with the support of BACW National, because without the racial curriculum, I don't think it would have happened.
Okay.
So that's one of the things that we want. And the town hall meetings, the strategic planning that's coming out of that, we're going to reach out. We're going to reach
Perfect.
out. Yes, yes.
Thank you so much. Keith, your hands.
I just want to conclude and just say thank you so much, Jacqueline, for your leadership there in Illinois. BACW National, as I said earlier, is here to support you through efforts of showing up with you side by side, you being a lead chapter, our Sankofa Leadership Institute, one of our products and tools, the Race Equity Strategy Areas, the RESA, and then just any way that we can help you and assist you in the movement, please do so. And I would just say to you, don't get weary in doing what is right.
Absolutely.
So with that, we just salute you and thank you so much. And I look forward to that time I'll spend with you all at your upcoming Leadership Institute.
Thank you, thank you. And I can speak on behalf of BACW Illinois. We could not do any of this without BACW National. You gave us the will to do this. I can even go back to the conversations I had with Dr. McDaniel back in the 90s that really put it in our ear. So we're partners with you. We're going to always be partners with you, and you're going to constantly receive emails from us.
Keep them coming.
Okay, take care. It was a pleasure. I always love an audience when I can talk about child welfare.
Well, I'm going to
Thank you
leave
so
you
much.
up there so we can keep looking at you towards the end. But thank you, everyone, for joining in on this podcast. Thank you, President of BACW, Keith Bostic, for just handling this whole entire piece. Thank you. It's a pleasure to meet you. And I'm so excited about the work that BACW National and BACW Illinois will continue to do. Thank you all so much and take care.
Okay, likewise. Take care.
Thanks, man.
Bye-bye.